Hi, I'm Dr. Kevin Cheng, founder of Osana, a health service dedicated to transforming lives through prevention. Over the years, I have reflected with colleagues on what we wish people did so they can avoid pain, surgery, or developing a chronic disease. Often the answer lies in embracing a proactive mindset and putting healthy lifestyle practices into action. By doing this, the upside is not only better health, but also saving us time, money, and stress in the long run. In this podcast, I'm joined with my friend Saxon Piggott to chat with a new health expert each week. We'll cover practical ways to look after ourselves, how to prevent illness, and ways we can be inspired to live well. Welcome to Prevention Hacks, the weekly conversation where we go to health experts for advice, so you don't have to.
And today our guest is Principal Audiologist Karen Hirschausen from Hearing Australia. Karen, tell us a little bit about Hearing Australia.
Morning, Saxon. So Hearing Australia is a government statutory authority. We've been around for 70 years. We were an organisation that started just after World War II. There were a lot of veterans returning back from World War II with hearing loss. And at around the same time, there was the rubella epidemic sort of happening as well. So there were a lot of children at that stage also being born with hearing loss too. So the government set us up 70 plus years ago. We're a nationwide organisation, so you'll find us all over the place. We do a lot of work in outreach communities as well, so our stretch is very, very broad. We're unfortunately not so much in the remote communities at the moment due to COVID. But normally we'd be seeing people all over Australia, and we're here for all Australians. So from the moment you're born, all the way through life, Hearing Australia is here to help people of all ages.
That's fantastic. Who do you find is the demographic that you guys are seeing the most? Is there a certain age group that are coming to you?
Yeah, so probably the two most common causes of hearing loss is ageing and noise exposure. So over the age of 50, your probability of developing a hearing loss starts to sort of get higher and higher. So once you hit age 70 and 80, roughly around 70 to 80% of people will have some degree of hearing loss. So that is a demographic that we see really regularly. We also do see a lot of children as well, both children that have been born with a hearing loss and also children that may come to us with a preventable hearing loss as well. So by preventable, a wax blockage or a middle ear problem such as an ear infection or otitis media. But yes, so generally we're mostly working in that younger age group and the older demographic as well.
Karen, thanks so much for joining us on the podcast. And as a GP, I suppose I see a lot of patients in their lives who have hearing and it impacts their quality of life. What do you see as being the worst that can happen if those that need to get tested don't get their hearing assessed?
Yeah, so probably the main thing we start to notice is social isolation. So that risk of developing depression or anxiety issues because of becoming socially withdrawn is probably our main area that we want to try and help people with. So yes. Hearing's a really important sense for keeping people connected to each other. It's our main sense that we use for communication. So when we're starting to sort of socially withdraw, it can have an impact with regards to mental health. There are some other issues as well, such as an untreated hearing loss can give you or can be indicative of a higher risk of falling, which is a huge concern for people in the older age bracket. And there are some sort of potential causal links or common causes with other things such as diabetes, cardiovascular disease, and potentially dementia as well. The cochlea is a very vascular organ, so anything that's related to blood flow or restriction of blood flow can have an impact on hearing. So it's not known whether one causes the other, but there are definitely links between those sorts of issues. But our main thing is trying to keep people connected with their families and friends. And obviously during this time with the pandemic happening, keeping connected with family and friends has become really important for a lot of our clients as well.
Have you seen much drop off in testing during the pandemic? And what would be some of the reasons why people hesitate, to get their hearing tested? What are the barriers to getting tested?
Yeah, sure. We haven't seen a huge drop off as far as people wanting to still get their hearing tested. During lockdown, it's a little bit of a problem. It can be a little bit trickier. Some of our testing we do need to do face-to-face. So to have a full hearing test done does require you to put headphones on and respond to sound. So that's not something that we've been able to do a full assessment for people via an online situation. We can do a screening online, but not necessarily a full diagnostic audiogram. Mm-hmm. So in some situations, people have still come into the office, and we've obviously got restrictions in place with regards to social distancing, and we wear masks and face shields. But no, we haven't seen a huge drop. In fact, we've probably seen a little bit of an increase in interest because people are starting to use things like FaceTime, or they're watching a little bit more television than before, and potentially starting to notice that they're not hearing as well, or they're relying a little bit more on the phone to keep in touch with family members. And other family members might be sort of suggesting it's not as easy to talk to you on the phone as it used to be. So people, I think, are definitely noticing potentially some issues with their hearing because they're not doing as much face-to-face contact, and they're relying a little bit more on other avenues, especially with the phone. We don't have the option of looking at the person when we're on the phone unless we're using FaceTime or Zoom or Skype. But without those visual cues, even with a mild hearing loss, it does make hearing on the phone that much more difficult. Once you take away that visual information, people do start to notice that they could be struggling a little bit more.
I often find that the older patient would be very hesitant about getting hearing aids, and it could be a blocker, a reason why they don't go ahead with a hearing test if it's referred by us as GPs or suggested by a family member. So what are the costs, and what's the stigma involved in getting the hearing test and getting it fixed if there's any deficit?
Yeah. So we know on average people tend to wait about 7 years from the onset of them noticing a hearing loss to actually doing something about it, or talking to somebody about it. So it's quite a long period of time. There is a little bit of a stigma, I think, attached to hearing aids. So people may view them as something that you only need when you're old, and we don't like to admit that we're aging. And there has been a long-term stigma attached to hearing aids, with people feeling that they're really big and bulky items and that they're a nuisance, and they won't be able to get used to them, or they won't be able to wear them in certain situations. But the technology in hearing aids has really advanced. They're really highly sophisticated little microchips now with computer memory in them. They do a lot of fast sort of data analysing, so they can analyse different situations that you're in and adapt. And they're quite small as well. So once I think people come in and have a look and see what other options there are, hearing aids aren't always the answer as well. There are other devices that we can suggest or trial for people too. And in some situations, it may just be having a talk to a clinician and maybe coming up with some strategies for different environments that you're in as well.
Sure.
But yeah, a little bit nerve-wracking coming in to do a hearing test. Often find when I'm testing somebody, you might find that they're holding their breath at the same time because they're trying really hard to hear the softest sounds. So it's always like, don't forget to breathe while you're doing your hearing test.
And to give our listeners the confidence that this is something that can be addressed, during those 7 years of waiting and potentially suffering, from hearing loss. What's the evidence that there are, improvements in well-being and quality of life. What do you see as being out the other end when people do get tested and get their hearing deficits addressed?
Yeah, it does come really back down to being connected back again within family. So we do see a lot of clients come in, and it may not have occurred to them until we start talking to them about it, but they've started to socially withdraw or really avoid particular situations that they might have once enjoyed without sort of even realizing it. So it can be common for us to hear from clients that they used to enjoy going to a Rotary meeting or a Probus meeting, and they've stopped going because they're finding it too difficult to follow what's going on, or they're having to withdraw from the social part afterwards. So when everybody's standing around having a cup of tea and a chat, they're finding it really difficult to follow the conversation. So they completely withdraw from those environments that used to give them a lot of pleasure and joy. So that, I think, is really the main thing that we want people to understand or to address, is we don't want people to be avoiding situations that they used to enjoy, where we can sort of offer some assistance for clients. So whether it be a hearing device, or as I said, whether it be just maybe practicing some strategies and tactics that they can use in that environment. We really don't like seeing people withdraw from social situations just for that reason.
Sure.
Karen, I used to work in my 20s in some pretty noisy environments, and I know that exposure to noise over time is one of the precursors to hearing loss. Is there anything that people can do to prevent hearing loss or delay it?
Yeah. So noise exposure is a really big problem, definitely with regards to your hearing. So we know probably about over a third of hearing losses are due to noise exposure. And it's not just the working environment that's the concern, it's actually more the leisure noise that we expose ourselves to these days. It's a bit more of a problem. Australia's pretty good with regards to industrial standards as far as workplace noise. So we don't see as much noise exposure due to work environments now, but it is much more related to the leisure noise. And people often think it's to do with the volume of noise. That's the problem, and that's not usually the case. It's actually the amount of noise, or the length of time that you're exposed to noise. So in a workplace environment, 85 decibels for 8 hours is what is appropriate. And 85 decibels is sort of loud speech. So if you were sort of raising your voice a little bit higher than what we're speaking at the moment, that's roughly around 85 decibels. So ears can tolerate that for 8 hours without noticing any damage. But every 3 decibels above that, you actually halve the amount of time that you can be exposed to noise. So anytime you might have been in a club or a concert and you go home at night and you notice that little ringing in your ears, or you feel that your hearing's dulled down and you're just not hearing as well, that's generally an indication that you've exposed your ears to too much noise and you've caused yourself some damage. Tinnitus is often a sign of early hearing loss as well. So anybody who does get ringing or buzzing in their ears has often exposed themselves to enough noise that their hearing has been damaged. We can kind of expose ourselves to a little bit of noise for a few times, and the little hair cells in our cochlea will lay down for a little while, and then the 24 hours they'll come back up again. So you might have noticed yourself, Saxon, after being at a concert, your hearing drops down a little bit for a while, but then 24 hours later, it's back to normal. But we can only do that so many times before the little hair cells in the cochlea stay laying down, and that noise damage becomes permanent.
Thankfully, my clubbing days are over.
It is a
I do
cumulative
hear
effect.
Occasionally there's reports coming out about a cure for tinnitus. Is that something that they've managed to achieve yet, or is that still a long way away?
That's still a long way away. There've been a lot of different theories over the years about what causes tinnitus, whether it's created in the cochlea, whether it's created within the auditory nerve. So no, we don't have a cure for tinnitus, unfortunately, at the moment, but we do have a really good program where we can talk to clients about counselling, about managing tinnitus, and potentially using some sound therapy to sort of adjust to the sound of tinnitus. But unfortunately, no magic cure as yet, no pill, unfortunately, to take for that. One thing I do suggest to clients, because noise with leisure noise is the big concern at the moment, if you're wearing headphones, and that tends to be our biggest area of concern because a lot of people are wearing headphones a lot more these days than they used to. If your conversation partner can hear the music from a conversational distance through your headphones, then it's too loud. It needs to be turned down. So you should still be able to carry on some degree of conversation at conversational distance whilst you're wearing your headphones. So we recommend headphones that have a noise limit on them, especially for kids, and even some of the Apple devices or Android devices will have a noise limiting program in them as well. And we definitely recommend using that too.
Well, thank you, Karen. That's all the time we've got for today. It was great to have you on. Any final advice for people who are managing issues with their hearing?
Yeah, definitely don't be afraid. Don't leave it 7 years to come in and talk to an audiologist about your hearing. One thing we are finding at the moment, obviously in the midst of the COVID pandemic, there's a lot of mask wearing happening, and that can be a real concern for clients who have a hearing loss. There's been a lot of work done both by the National Acoustics Laboratory, which is our research arm, but also hearing aid manufacturers, and they've come up with different algorithms for clients who are wearing hearing aids, who are trying to communicate with somebody wearing a mask. So if you're finding it really difficult in that environment at the moment, talk to your audiologist. There could be a specific setting that we can set in your hearing aids to overcome that concern. And also remember with your noise exposure, if the person sitting next to you or standing next to you can hear your music, please turn it down.
Karen Hirschausen, thanks very much for joining us. Oh, Kevin, sorry.
I was just going to ask and finish on, Karen, thank you again. And if someone wanted to get tested, we know that at Osana we run hearing clinics. We also refer to audiologists, but where can folks get tested through Hearing Australia?
Yeah, so as mentioned earlier, Kevin, we're nationwide, so there will be a Hearing Australia located somewhere near you. There is also online on our website. We have an online hearing test that if you can't come into the clinic at the moment and you just wanted to have a check of your hearing, a bit of a screen, or just to get an indication whether you should have it looked into a little bit further, you can go to our website at www.hearingaustralia.com.au, and the National Acoustics Laboratory have developed an online hearing test that people can complete there.
Wonderful.
Yeah, and also if you're concerned about noise exposure, they've also developed a Know Your Noise risk calculator as well. So we direct a lot of young people towards that as well, and you can calculate whether you're at risk for noise exposure.
Well, thank you so much, Karen, and look forward to talking again soon.
Thanks, Kevin. Thanks, Axon.
Thanks, Karen.
Thanks. Bye.
Bye.